My name is Cordelle. I am here with Mr. Jones. I am going to ask him for consent to make this video and also make a YouTube link in order to share with my professor. Do you give consent, sir?
Yes, sir.
Alright, consent has been given. We're going to be continuing and doing a musculoskeletal examination, and I'm going to start with his hands. And with his hands, what I'm going to do is I'm going to inspect and look at his arms just to make sure there's no lesions, there's no swelling of the joints, there's no discoloration, there's no clubbing of the fingers, there's no redness or tenderness. Alright, so I'm going to start palpating his joints. Okay, phalanges up to the wrist. Okay, do you have any tenderness? Okay, and you're feeling to see if there's any abnormal deformity or any tenderness on palpation. You look at the joints. Okay, what I'm going to ask you to do is hold your hands like this, and we're going to look at the fingers and we're going to actually abduct and then bring it back. And what I want you to do is that I want you to turn it up for me, and I'm going to actually perform what we call an Allen's test. With an Allen's test, is actually checking for the perfusion of the hand, and this would be like if somebody wants to take an arterial blood gas. So before doing that, they will actually press under both arteries to see, and then release one, just have the hand actually what we will call pink up or reperfuse, and that would be the Allen's test. If you have carpal tunnel, what you can do to test for carpal tunnel is you actually feel and you slightly tap, and if the person has like sensation or nerve tingling in this arm, there's a sign that there's possible carpal tunnel or nerve injury or the tendon hyperextending. Could you do this for me in the praying situation like this? Alright, and press with it 30 seconds. Any tenderness? And you can do it like this also, the reverse, pressing together, or even like this. It's easier, and press against it. And is there any tenderness? Okay. So what I'm going to do now is move up to the wrist on both hands, and I'll be looking to see if there was any tenderness, deformity, and stuff like that. And I'll ask you to actually, on the inspection, there's no deformity, and then on palpation, there's no tenderness, no abnormality found on it. And what I want you to do is actually flex it. So you actually keep it straight and hands up, and then you could actually closely flex it. Okay, and could you rotate for me like this? And is there any tenderness? Okay, all right. So one of the things I also tell people is to make a fist. All right, and in that fist, I want to also test your strength as well. So good. Okay, so then just on your hand for me. Perfect. So now we're gonna go now from the wrist to the elbow. With the elbow, I'll be actually inspecting the elbow, and I look at the elbow on one arm just because he's covered, and we would look to see if there was any bony prominence, if there was any abnormality, if there was redness, tenderness, swelling, tenderness when palpating as well. And for tennis elbow, or you would be thinking about if somebody had golf or tennis elbow, to actually palpate the tendons here and actually ask if they have tenderness. Okay, so we'll do flexion and extension of the elbow. Okay, and we will do abduction, so you move it away, and adduction, which you move it across to the middle side of the body. Okay, and with that we actually assess the elbow joint. I would like to do supination on both arms and pronation. Okay, and that's really to assess the flexibility of the elbow. Okay, now one of the things I'll do is actually move here to the shoulder, and the shoulder is one of the biggest joints, so you really want to actually inspect the shoulder. So I'll be inspecting it, and we inspect the shoulder. We look to see if there's any deformity. You look and see if there's symmetric, because if somebody has a deformed shoulder, it will actually be a little bit slanted on the side, but in his case it's actually symmetric. And now I'm actually going to start palpating his clavicle and moving down to the xiphoid process here, and then I'll be feeling his scapula as it comes to make the joint. What I will do is actually have him do like a back scratch to actually extend. Okay, and what I'll do is actually ask you to bring it back to the back, all right, and do a back scratch and see if you can touch your back of your scapula. Okay, then you could bring it up to 180 degrees, all right, and then you could bring it down for me slowly. All right, good. So if for some reason there was a tear in his tendon and the shoulder or injury, you may drop, but in his case we don't have any of that. All right, and then what I would want you to do is actually bring it to the 90 and bring it back. So that's adduct to your hands and abduct. Okay, all right, and that's the flexion and extension. And what about rotation? Could you do that for me? And you would do it on both hands. Okay, because you want to compare if there was tenderness or pain or discomfort at the time. Okay, so moving on to the neck. When you look at the neck, you want to look from the spinal cord all the way to the C-spine. You want to look and see that the trachea is actually aligned and not deviated. You want to be able to actually palpate the neck to see if there's any swollen, if there's any air trapping as well, and if he has any tenderness. So I want you to flex and extend. So you put your chin to the chest, so you flex and you extend. And is there any tenderness? Okay, now what I want you to do is actually rotate left and right. Okay, and could you do the bending from side to side? Have your ears touch one side and then the other side. All right, and any tenderness. And that's how you check the actual neck. Okay, what I can ask you to do is stand for me. What you want somebody to do is that you want to look at their spine. So I'm going to turn you slightly, and you're going to look at the spine. You're going to actually look to see if there's any obvious deformity. Of course, he has clothes on, but in the best factor, he'll have no clothes. And you'll look at the spine to see his alignment, how he stands, and stuff like that. You would actually feel here his pelvic.
SA pickup in X-ray. Available SA pickup in X-ray.
His pelvic. Just to actually put your hand on his pelvic bone to see if there is actually any, I would say, limb that is longer or shorter than each other. So you put your pelvic, hands on your pelvis, okay, and it's normal and it's symmetric, and it's at the same height. So what you can do is actually lean forward slightly, like touching your toes as much as you can, and you would look to see if he has scoliosis, because you'll be able to palpate coming down and also check to see, and his spine is actually straight. But in a scoliosis patient, there'll be an S shape or a deviation, and you could actually see it, if not when standing, when they actually flexing an extension. So you could lean forward for me. All right, any lower back pain? No. Then I tell people, see if you could lay back as much as you can, not to fall over, and support the patient. And this is actually good. Any tenderness? All right, so what I'm going to do for you is ask you to now turn this way, and you're actually going to do the same thing, like the bending from side to side. All right, and you look and see if there was any tenderness. Good. And then can you do a twist of the spine? All good. And what that is actually bending and then the twisting of the spine to check. Okay, so I'm gonna actually have you sit back now. And what we're gonna move forward to is actually the hip. Okay, you may lay down. Thank you. So with the hip, what you want to do is you want to be able to actually have him abduct and adduct and actually moving forward. So I will inspect the hip and see how, in his case, if there was any hip pain, we'll have him undressed to be able to identify if there was any deformity, if there was any tenderness. You would palpate, of course, the hip, the joints. You want to be able to tell if there was any pain or any tenderness, if he had any injury, if there was any deformity, of course, on inspection and palpation. I would ask you if you can do me a favor, and for your hip, what I want you to do is actually make your legs cross one leg, all right? And that's actually what we will say adduct the hip. And then if you could turn to your side for me, you could face this way or this way, all right? And whichever way is comfortable for you, okay? And what I want you to do is actually raise your leg like this, which is the adduct. Yep. Away, yep, and back down, all right? And what we will be doing is actually checking the hip itself, okay? And we're checking to see the flexion and extension of the hip joint, all right? So you have done this for me, and now you have done the removal of the abduction, and I want you to just do the flexion. So could you lean forward for me? I mean, lay on your stomach. And what I want you to do is put one of the legs all the way up, as much as you can, and I'll support it. And that's actually checking to see the extension of the hip joint. Okay? And you can turn back for me. I know I have you turning up and down, I'm so sorry. But a patient with complication will not be able to perform some of these tests. Alright? And if you could slightly lean back, lay back, and actually bring it up straight. Okay, good. And you will do this on both arms. I mean both legs, of course. Alright? But in this case, I'm just showing one. Okay. So, for me, what I want you to do is we want to be able to move to the knee. Could you sit for me? Thank you. Sorry. And with the knee, what you want to be able to do is you want to be able to identify the knee as being able to palpate, and you actually start with inspection, but you want to be able to look and see if it's symmetric, if it's equal, if it's swollen, if there's fluid in both knees, if it's red, if it's hot to the touch, of course, when you start palpating. And you want to be able to identify if there was any tendons or tenderness here at the joint, okay? If it's also formed, if there's any diffuse. Looking at the kneecap as well, and it meets to the humor and the fem. Okay, and what he will be doing with this is actually asking him to extend and flex his leg, and flex as back as you can. Yeah, good. As far as you can, it's fine. Yes, thank you. And what you want to do is you want to be able to rotate the joint just to be able to identify if there was any unable to move the knee to suit. All right. And with the knee, what I'm going to do is actually check to see if in the palpation if there's a called a Baker cyst, which is a cyst that you could find behind. Okay, and in his case, there's no Baker cyst. All right. What I'm going to ask you to do is actually lie down, and I'm going to show you if you can lie on the bed.
On the back?
Your back. And I'm going to use one of your legs, and I'm going to take your shoe off just because I'm going to get the feet soon. And what I'm going to do is actually put your legs up like this, and I'm going to sit here, and I'm going to actually put pressure. And if he has tenderness or a knee injury and you wanted to check to see if the tendon was involved or if there was a deformity or a tear, you would have tenderness when you push on it or pull. Okay, and that would be more of having tenderness. So this would be a Clary sign. Okay, and then you would put this down. All right, and I'm going to do the vagus and vagus move where we're going to actually have my hand and this hand, and I will be pushing to see if the knee is actually moving. If you see the knee or the tibia and fibula actually moving, then there's some form of concern for a detachment or a tear. Okay, and I would do that as well on this side, and there's no movement of the joint. It actually stays in place. Do you have any tenderness? Okay, thank you. And from there, I would actually look at his ankles. When you look at his ankles, you see if there's any edema, if there's any swollen, of course, any deformity, redness, or if there's any concern about an injury. And for your ankle, could you rotate for me like this? Okay, all right. And could you flex and extend? Okay, thank you. And now I'm gonna actually just palpate his foot. Okay, and is there any tenderness? The back of the heel, and also the joints. And I would look and see on both legs, of course, if there was any redness, tenderness, if there was any change in color, concern for perfusion as well, or if there was any ulcers that were in a diabetic patient. That's the time you would be able to assess that as well. All right, and for specialty testing, what you can do, if you can sit up for me, I'm just going to do a special test to see if there was a rotator cuff injury. And a person, if you have a rotator cuff injury, say I bring them like this to 90 and I go up and I push it back, then it would be a concern. There'll be some tenderness and stuff. So if I hyperextended it, it would be some sign of tenderness. If I asked them to actually scratch his back, it would be a sign of tenderness as well. He wouldn't be able to get it that far up. All right. So that's one of the specialty tests that you can perform for the rotator cuff. All right. Excellent. Thank you for your time, sir. And this concludes the musculoskeletal examination.